Let's talk about something that on the surface looks like really great news. In late 2025, the Indian state of Meghalaya finally rolled out new rules for mental health care. Now, you'd think that's a clear win, but when you dig a little deeper, you find out this good news is actually the end of a shocking 8-year delay, a delay that happened right in the middle of a growing mental health crisis.
So, the official announcement made it sound like a huge step forward. The chief minister said the new rules would provide a, quote, structured framework for institutions that, and this is also a direct quote, had been operating without proper regulatory oversight.
And that statement right there, well, that brings us to the real heart of this whole story. See, India's parliament passed the main law all the way back in 2017. So the big question is, why on earth did it take Meghalaya a full 8 years to write its own rules to actually make the law mean something?
Okay, so to really understand the weight of that 8-year gap, we first got to break down what this whole legal framework was supposed to do from the get-go.
The foundation for all of this is India's Mental Healthcare Act of 2017. And this thing was a huge deal, a really progressive law meant to guarantee every citizen's right to mental health care and protect them from abuse. But there was a catch, a really critical one. The central law was just the blueprint. It was up to each individual state to create their own set of rules to bring it to life.
And this right here, this really says it all. A law without rules is basically just paper. It's totally toothless. It creates this dangerous vacuum with zero oversight and zero accountability. But once you add those rules, suddenly that same law has teeth. It creates clear standards, real accountability, and actual protection for patients.
Which of course brings us right back to that 8-year question. Let's look at the timeline.
You can see how this all played out. The Central Act passes in 2017. Within just a couple of years, other states like Kerala and Karnataka already have their rules in place and are moving forward. Meanwhile, for the next 8 years, Meghalaya is just stuck in that regulatory vacuum we just talked about. Only at the very end of 2025 do they finally get their act together.
8 years. It's worth just pausing on that for a second. In the context of a public health crisis, that is an absolute eternity.
So what does it really mean when a law this important is just left sitting on a shelf gathering dust?
And here's the kicker. Remember that statement from the chief minister about institutions operating without oversight? Well, when you think about it, that wasn't just a justification for the new rules. It was basically an open admission of 8 long years of systemic neglect. And this neglect didn't happen in a bubble. During this exact same time, Meghalaya was grappling with rising suicide rates, serious substance abuse problems, and a mental health crisis that was just getting worse and worse, especially after COVID-19 hit. The need for these rules wasn't just important, it was urgent.
And that brings us to the real human cost of this massive gap between passing a law and actually doing something about it. This is where the story shifts from bureaucracy to real life, and it leaves us with some pretty gut-wrenching questions. You have to ask, during those 8 years of no rules, how many patients were mistreated?
And what about their families? How many of them struggled, desperately trying to find proper care for their loved ones, in a system that had no clear standards to follow?
This is the grim reality of that gap. For 8 years, anyone seeking mental health care in Meghalaya was walking into a system with no standardized protocols, no formal way to complain if things went wrong, and no state agency checking up on the quality of care. These are the exact problems the 2017 Act was designed to solve.
So, the rules are finally here. But the question now is, what's next? Is the work done? Not even close.
This is where accountability really kicks in. The source material lays out a clear path forward for citizens and journalists. First, you have to ask how many places were actually inspected before these rules. Second, you have to verify what's actually different on the ground since December 2025. And finally, you have to keep asking the most important question of all. Is it going to take another 8 years just to implement them?
And that is the final heavy question that hangs over this entire story. After an 8-year wait just to get the rules written down, the real work is only just beginning. And now, the people of Meghalaya are left to wonder if turning these rules into reality is going to be another long, long fight.